Our Chief Medical Correspondent Dr. Narula, thank you for coming in so quickly about this. It was alarming when we woke up to this news. So tell us, how contagious is TB and what are the signs and symptoms?
Right, so it's a bacterial infection that primarily affects the lungs, but it can affect other organs. It's spread through the air when someone who has active TB coughs, sings, or speaks. And as you heard, it can linger in the air for a few hours. You can have two conditions, inactive TB or active. Inactive means you don't have symptoms, you can't spread it. However, it can reactivate at some point later. About 1 in 10 people that will happen. If you have active TB, the symptoms would be usually a cough that's prolonged over 3 weeks. Sometimes a bloody cough, fever, night sweats, chills, weight loss, fatigue, weakness. Those would be the things to be looking for.
Can you help put this in perspective for us? I mean, how rare an outbreak like this, and what about the testing and screening and treatment for it?
Right, well, you also heard, I mean, this is the leading cause of death by an infection globally, but we don't think about it a lot in this country. However, we see outbreaks every year. In fact, we see cases every year. There are about a little over 9,000 cases reported in 2023. We've seen an uptick since COVID, about 13 million in the U.S. living with that latent or inactive TB. So not uncommon, but yes, we get concerned when we hear these numbers. However, it is important to note, I think this is the big picture, that this is a very low risk to the general public. They're working to really get it under control by identifying patients and treating them. There is a treatment. We usually give a combination of medications over about 3 to 9 months. There is testing that you can do, blood tests or skin prick tests. And there is a vaccine, although we don't use it in this country. But, you know, big picture, the numbers sound alarming when we hear outbreak, but we do see this every year.